we are seeing a lot of teenage pregnancy, 29% teenage pregnancy consistently for many years, and a huge HIV increase amongst young people. And so these are signs that there is a lot of engagement in sexual intercourse below the age of 18, because otherwise we will not be having the 29% teenage pregnancy for children who are basically young people. And so these young people need to be saved, and one of the ways they could be saved, of course, is through information which is being given to them through life skills and health education, but also we need now to also ensure that they have the services and products which could help them to avoid teenage pregnancy and avoid HIV plus many other diseases.
And I feel it is a very important exercise because we know what the reality is on the ground. Young people are indulging in sexual activities below the age of 16. So giving them access to services, reproductive health services, is a very important activity.
Good that we have even reflected in our policy documents about the provision of services to adolescents without the consent of the parents or guardians. But as you can see from this discussion that we have, we still need takeaways in terms of how best can we understand locally the laws that are supposed to be applicable on the side of service provision to adolescents and young people.
I think the key takeaway is there's still need for the discussions on whether there should be an age limit on who is to access the sexual reproductive health services, because I feel like there is a lot of conflicting suggestions in as far as that is concerned, because one might speak on a parent's perspective, another may speak on an advocate's perspective, and another may speak on a youth or a child's perspective. Because to begin with, the parent's perspective, I think we might say it should be a very difficult thing to say my child who is maybe under the age of 21 should be going and getting sexual reproductive health services. But should we deprive those children of, that is the question anyways, should we deprive those children of those services? The answer is definitely no. From maybe an advocate's perspective, the question might be, if we put an age limit, what about the others that are below that age limit but they are sexually active? So I think there's still a lot to be discussed in as far as the age limit is concerned on who is to get the sexual reproductive health services. And from the child's perspective, I'm a child. I have my parents would be considering me as a child even when I'm grown, but up until today I don't think they will be very open-minded in telling me that yes, go ahead and go get sexual reproductive health services, or maybe we might say contraceptives, because parents always see us as innocents in their eyes. So it's something that needs to be discussed. There's need for further discussions, and maybe also enlightening the parents, the advocates, and even the children, so that each and every single one might be or might get what is best for them, the parents, the children, but then also the advocates.
But then there is a lot because the documents, the laws should be disability friendly, so that young persons, adolescents out there with disabilities should be in the know of what is it all about in terms of ASRH laws. And also the documents should be some in braille and large prints, so that those with visual impaired and other impairments should be also be included.
My perspective towards healthcare access for adolescent minors is that the adolescent minors need to consent for healthcare services, so they need to be provided enough information to be able to make the decision to accept health services. However, they also need parental or guardian consent for the guardian to be able to take responsibility because they're able to understand better the risks and the benefits of the treatments that the healthcare worker is providing. In addition to this, the parent to the adolescent is also there to facilitate the adolescent throughout the course of treatment for whichever ailment that there'll be, because it goes more even than the actual consenting on a piece of paper. It's more about the moral support, the spiritual support, and the guidance that they do provide to the adolescent when they're having any health issue.
The recommendations that stood strong were not only from the room, but mainly the stakeholders, adolescents who have gone through various issues in regards to healthcare. There are those who are adolescent moms, there are those who are teenage dads, there are those who are who were adolescents in drug use and alcohol use, and also young sex workers who began their activities in adolescence. The recommendations that stood out was the multisectoral approach when it comes to healthcare, and Ministry of Health should work in collaboration with other organizations to ensure that adolescents receive services. There was the parental aspect, the need to get parents involved, and this also include empowering parents to be able to deal with adolescents. Another recommendation was empowering the adolescent. It came out strong from the young people that most adolescents do not get comprehensive information in regards to their health, and mostly sexual and reproductive health. There was the role of the church which has been a lead in guiding our community. Adolescents felt and young people feel that there need to be improvement when it comes to church leaders and acceptance in whatever situation they are going through.
Now the question is, we have Article 11 in the Child Code Act that requires that any child will get any services in terms of health and related with parental consent or support, and it is the responsibility. Whilst they have a right to health, it's the responsibility of the parent or guardian to get them these health services. Therefore, our health system is unable to give ASRH services or products such as contraceptives to children under 18 years because they need parental consent. So if they are going to get these, they need to have parental consent. And where a child has been found, for example, pregnant below 16, our health service has invited, for example, police to come and interrogate to who pregnanted the under 16. Now, of course, that is providing a challenge to the issue of consent, because for these children who are under 18, they are having a challenge to access these services and products. And so what we are looking at as primarily policymakers in terms of legal and working with government and other stakeholders is to have a provision that will allow SRH services to reach young people below 18 without much hindrance, with a bit of ease.